Okay, so today we're going to talk to you about one of the best stretches that you can do for your neck. Okay, but before we get into the actual stretch, let's talk briefly about the tissues that we're actually targeting. So the tissues, the muscular tissues that we're trying to get length into or facilitate eccentric behaviour within are the tissues that will elevate the scapula and the tissues that will retract or pull the scapula back towards the spine. So to get some length into those tissues, what we need to think about is what kind of movements do the humerus, the scapula and the ribcage have to express to facilitate that eccentric length. Okay, so what we need to do is we need to facilitate an external rotation or outward rotation of the humerus to facilitate that dropping of the scapula on the same side. And then we need to couple that with a protraction of the scapula. And we're going to do that by reaching forward and in a downward angle to try and facilitate that reaching and that wrapping of the scapula around the rib cage. Once we engage that position, what we actually want to do then is get some load into these tissues that are expressing more eccentric behaviour. And we're going to do that through horizontal humeral abduction. That's going to help us get some load into those tissues. It's not going to be a high force output, it's going to be around 30 to 40% of our maximal voluntary capacity. Once we engage that, then we can manipulate either the rib cage position or the head position. Okay, so we're going to perform this stretch in a seated position. Now in the seated position, we don't want the spine to be too upright, where it stops that capacity to protract the scapula, but we also don't want to be too flexed forward either. Okay, we're going to begin with the knees slightly outside hip width, so we can position the upper limb that we're targeting on the inside of the leg, because that's the leg that we're going to be building that horizontal abduction into. We're going to position the upper limb on the inside of the leg. We're going to externally rotate the humerus, so the bicep is facing forward. You don't have to externally rotate the forearm, so the palm is facing forward, but as long as the humerus and the bicep is facing forward, that's fine, because if we turn the bicep inwards, where we internally rotate the humerus, you're going to notice that couples with that elevation of the scapula, and we want to facilitate the opposite. So we're going to get that external rotation, and then we're going to reach the fingers slightly downward to facilitate that protraction and that depression of the scapula even further. Okay, so maintaining that external rotation, that gentle reach. We want to make sure that we're not reaching too strongly to the point where we're getting that rotation of the chest away. We want to keep our chest facing forward. Okay, so external rotation, gentle, soft reach downwards. We should feel a little bit of a length in those tissues already, but maintaining that position, what we're going to do is we're going to build that tension into horizontal abduction, so into the inside of the leg there. So reach, external rotation, build that tension, holding the chest facing forward, and even in that position we should feel some load going into those tissues in the back of the rib cage. Now once we engage this position, once we hold that pressure for 30 to 40% of our max capacity, what we're going to do then is we're going to manipulate two things, either the rib cage or the head position. So the first option we have is to manipulate the movement of the rib cage, particularly through rib cage flexion. So as we engage all these previous components, external rotation, gentle downward reach, and then horizontal abduction, if we take a gentle breath in through our nose, we're going to feel an extension of the rib cage, but then what we want to try to do is extend the exhalation to facilitate rib cage flexion, all while we maintain those previous components. Because as we flex the rib cage, that's naturally going to get more lengthening into these tissues that elevate the scapula. But what we're going to add is an extra component to it, because we're going to reach, external rotate, build load into horizontal abduction. Then we're going to laterally flex away so we feel a gentle stretch into these tissues already. Then we're going to hold that position, hold that load. We're going to take a gentle nasal breath in, and then a nice long exhalation through the mouth. And we can use the opposing hand here to facilitate that ribcage flexion on the exhale. All while we're holding that reach, that external rotation, and that load into horizontal abduction. As you flex the ribcage, you're going to feel greater lengthening in these tissues. But it's important to maintain an upright spinal position so that we actually have room to move the ribcage through that flexion. If we're already in a flexed position, then we don't have the capacity to move that ribcage through that excursion. So hold that position and take 6 to 8 breaths. And option number 2 is to add a head nod as we maintain all those previous components to get further lengthening into those tissues. So we're going to reach, externally rotate, keeping an upright spine, build that tension into horizontal abduction through the upper limb. We're going to laterally flex away, holding that lateral flexion. Then we're going to add a yes nod. Okay, so it's not a big motion of the cervical spine, it's just a motion of the skull on the cervical spine, so we can feel that lengthening of the tissues even further, perform 10 to 15 head nods, and just maintain that lateral flexion away, maintain all the previous components, and we should feel a lot more dynamic lengthening of those tissues. Now, the key point to understand with this stretch is that it shouldn't be treated as a standalone strategy. It's a local strategy to improve or alter the muscular behaviour of these tissues. But we also need to identify and address the whole limb and the whole midline's capacity to distribute forces over broader surface areas.